Hello everyone, welcome back to our channel. Did you know that individuals with diabetes are at a higher risk of developing tooth decay and gum disease? In this video, we'll unveil the top 7 oral health tips specifically tailored for diabetics. Stay tuned as we dive into the essential strategies to protect your smile and well-being. Number 7. Monitor for signs of gum disease. It's crucial for diabetics to stay vigilant and monitor for any signs of gum disease. Early detection is key to preventing serious oral health issues. Keep an eye out for symptoms like bleeding gums, redness, swelling, or persistent bad breath. Regular dental checkups are essential to catch any potential problems early on. By staying proactive and observant, you can address gum disease promptly and maintain optimal oral health. Number 6. Quit smoking. Smoking is detrimental to both overall health and oral health, especially for diabetics. Quitting smoking can significantly reduce the risk of gum disease and tooth decay. Tobacco use can impair blood flow to the gums, making it harder for the body to fight infections. By eliminating this harmful habit, you can improve your oral health outcomes and overall well-being. Number 5. Use an antibacterial mouthwash. Incorporating an antibacterial mouthwash into your oral hygiene routine can be a game changer for diabetics. These specialized mouthwashes help reduce the bacteria that cause plaque and gum disease, promoting healthier gums and fresher breath. While it ranks at number 5 on our list, the use of an antibacterial mouthwash offers an added layer of protection for those with diabetes. By targeting harmful bacteria in the mouth, diabetics can enhance their oral health and complement their brushing and flossing efforts, contributing to a healthier smile overall. Number 4. Visit the dentist regularly. Regular dental checkups are essential for diabetics to maintain optimal oral health. Do not hesitate to let your dentist know if your dentures do not fit right or if your gums are sore. Dentists can detect early signs of gum disease, tooth decay, and other oral issues that may be exacerbated by diabetes. While ranking at number 4, visiting the dentist regularly offers proactive care and professional guidance tailored to individual needs. These visits allow for timely interventions and personalized treatment plans, ensuring that diabetics receive the necessary support to safeguard their oral health. By prioritizing regular dental appointments, you can stay ahead of potential oral health challenges and preserve your smiles for years to come. Number 3. Floss daily. Flossing daily is a crucial step in maintaining oral health, especially for diabetics. This practice helps remove plaque and food particles from between the teeth and along the gum line where toothbrushes may not reach. While it holds the number 3 spot on our list, daily flossing plays a significant role in preventing gum disease and cavities, particularly in individuals with diabetes. By incorporating this habit into your routine, you can enhance your oral hygiene efforts and promote healthier gums and teeth, setting the stage for improved overall oral health. Number 2. Brush teeth at least twice a day. Brushing your teeth at least twice a day is a fundamental oral hygiene practice that is crucial for diabetics. This routine helps remove plaque, bacteria, and food particles that can lead to tooth decay and gum disease. While it secures the number 2 spot on our list, regular brushing is essential for maintaining oral health and preventing complications associated with diabetes. By brushing twice daily, you can protect your teeth and gums, reduce the risk of infections, and promote a healthy smile. Consistent brushing complements other oral health habits, contributing to overall well-being. Number 1. Control blood sugar levels. Controlling blood sugar levels is paramount for diabetics in maintaining optimal oral health. Elevated blood sugar levels can increase the risk of gum disease, infections, and delayed healing in the mouth. Securing the top spot on our list, managing blood sugar effectively not only benefits overall health, but also plays a crucial role in preventing oral complications associated with diabetes. By keeping blood sugar levels within target ranges through diet, medication, and lifestyle modifications, you can significantly reduce the impact of diabetes on your oral health, promoting a healthier mouth and body. In this comprehensive guide, we've unveiled the top 7 oral health tips for diabetics to prevent tooth decay and gum disease. From monitoring for signs of gum disease to controlling blood sugar levels, Each tip plays a vital role in safeguarding oral health. Remember, early detection and proactive care are key to maintaining a healthy smile. Explore these tips further to empower yourself in managing diabetes and promoting optimal oral well-being. Take charge of your health today and let your smile shine as a reflection of your commitment to overall wellness. I would love to hear from you. Please share your own oral health tips for diabetics in the comments below. Don't forget to subscribe to our channel for more health-related content and tips. Take care of your oral health, and until next time, stay healthy